Hello, my name is Dr. Mary Keilty. I'm a MacMillan clinical psychologist working in the MacMillan Psychology Service at Bedfordshire Clinical Health Services. Along with my colleague Lisa Dvorjets, we put together a webinar around the different areas of coping with a cancer diagnosis. These are focused on the psychological impact, what might be a normal adjustment, and some coping strategies. This last chapter, chapter 6, is around where you might go to should you feel you need further support. I'm going to share the presentation now so you can see slides. So this series of workshops is for people affected by cancer, whether it's yourself who's been diagnosed with cancer or whether you're listening and it's actually a loved one or close friend who has been diagnosed with cancer. And the series of workshops are aimed to help you acknowledge the emotional and psychological impact that it can have on yourself and those around you, and hopefully provided you with some helpful strategies or ways of thinking about this in terms of managing your emotions going forward. But we recognise that there's for some people extra support might be needed, and that might be now currently, or that might be in 6 months' time or a year's time or further on. And just to hold in mind that even though you might be coping now, that's not to say that you might not want to explore some of these in the future if you need to. Okay. So out of about 100 people with cancer, so this is just thinking about those who've received the diagnosis, around 15 are likely to need psychological help. So that means seeing a professional to help them. And although we've covered, what might be normal reaction in terms of levels of distress, feeling a range of quite intense emotions, whether it's anxiety, fear, denial, anger, sadness. For some people, this doesn't kind of get better or doesn't kind of improve. And actually, for some people, it's right that they seek further emotional support. And I guess just taking a moment to consider how you're doing, check in with yourself. You might want to pause the video. You might want this to be kind of something to reflect on, after you've watched this, or in part of a conversation with someone who feels supportive. But what's normal for you? Are you concerned at all about the way that you're coping? Do you see things settling down? And what type of emotional support might you need? Okay, so just in terms of some signposting, there is a wealth of different types of services out there to give you emotional support, practical support, financial support, psychological support, and this is some of the names of different organisations that are out there to help you. And just to say at the bottom in the red box, the contacts there are for the MacMillan Information Office. They often have lots of leaflets and very knowledgeable staff in terms of all the services locally. So for Luton and Dunstable and Bedford, those are the numbers, but you may well be watching this and you're out of area. So kind of ask your key nurse, where's your information office? It may well be in the waiting room. It might be in the kind of cancer centre. It might be tucked away somewhere, but a really good source of information in terms of finding out more about these services that I'm going to kind of go over now. So for different cancer tumour groups, there's often an affiliated support group. So these can be, these are a great source of support and information for people who are going through the same thing as you, and your nurse will be able to direct you to the support groups that they know of that would be appropriate for you. And also carers support groups. So there's carers in Bedfordshire, and they offer support particularly for carers, which includes counselling service as well. There's the MacMillan phone line, and you can Google that and get the number very easy. It's a free phone line for kind of emotional support, but they offer practical support, can signpost you towards other services. The I Hope course is currently being done online. It's a MacMillan course run locally by kind of nurses or practitioners who are trained in the I Hope course, and it's a post-treatment course, 6-week course to help you kind of get back into life again after your treatment. So well worth thinking about taking part in one of those when that time comes. Complementary therapies are a great way to kind of access that soothe system that we were talking about in a previous chapter, whether it be massage, Reiki, aromatherapy, and these can often be accessed through your local day hospice. They sometimes are free, sometimes there's a small supplement, but can be really good for your sort of holistic well-being. So Look Good Feel Good are, again, you can Google Look Good Feel Good. There's local ones down in towards the L&D hospital, and this is around sort of recognising the impact on your body image and your appearance, and they do kind of practical workshops around how to use makeup and wigs and how to feel good about yourself. Really well worth booking onto one of those. In terms of financial support, you've got the grants from MacMillan, and again, kind of contacting your MacMillan information office or asking your nurse about those. They can offer financial support. For those under 40, to be aware of the Willow Foundation Trust. Again, they're on the internet. They can fund special days for your family, and have a wealth of information on their website as well that's more geared towards young adults. There's the chaplaincy service in the hospital, and they have lots of different faiths, so you can ask for a specific faith, but a really good place even just to go and sit in the chaplaincy area where it's very peaceful and calm, or if you want to actually link up with one of the chaplains in the hospital. You've got the benefits advice. Again, there's MacMillan benefits rights that can help you with forms, help you make sure you're getting all the financial support that you could be getting. And for some people, they may feel that they need a more specialist psychological referrals. So as I say, I'm one of the psychologists in the psychology team, and we see people at any point in their cancer experience. It may be early on during diagnosis, during treatment. For a lot of people it's actually after treatment, and also in that post bit after treatment, and maybe even 1 or 2 years down the line they might want to come and have some psychological support. Our door is always open, but we ask that you contact your nurse specialist who can talk you through a referral and kind of work out what you might, make sure that the psychology service is the right thing for you, and make a referral to us. We accept referrals for anyone affected by cancer as long as they're over 18 and they have a GP in Bedfordshire or Luton. So it can be the person affected with the cancer diagnosis, or it could be the family members or loved ones. So we will be putting lots of handouts and links on our service webpage. So this is the service website. If you just want to Google ELFT, which is ELFT, cancer and psychology, those 3 words should come up. The first link you'll get is our MacMillan Cancer Palliative Care Psychology Service website. And on here you'll have access to the videos, reading material and some handouts, which I hope will help with getting more support beyond this webinar. And just lastly, again, this will be on our website as a separate document for you to download, but some book recommendations written by cancer survivors, as well as more self-help books like the Russ Harris ones at the bottom, around coping with cancer from real lived experience. I'll leave that on there just for a couple of moments so you can take a photo of it with your phone or jot a couple down. Okay, and that's our website. So that's the end of the webinar in Coping with a Diagnosis workshop. Thank you for listening, and really hope it's had some usefulness to hear about what is normal and some strategies to help with your emotions on this sort of roller coaster that you may be experiencing. Please get in touch with any of the services, accessing through your clinical nurse specialist or through the MacMillan information offices as well in the first instance, to get signposted to all the services out there that will help you in this difficult time. Do consider completing some our feedback questionnaire if you can. That's on our webpage, and so we can make this as useful and as helpful as possible. Thank you. Bye.